I always have to cut out the first couple of seconds because I laugh. Hi, Sheena.
Hi.
Thanks for coming in today. How are you doing?
Okay.
Yeah?
Yeah.
Had a good week? An okay week?
It was an okay week.
Okay.
A little tired.
Tired. Okay. I wanted to kind of touch on something that we just started to talk about last time you were here, and just kind of wanted to gauge how you're feeling this week. You'd mentioned that there's some tension kind of with you and your husband related to setting boundaries with your kids.
Right.
So what can you tell me about that this week? Because we just kind of started to talk about it when you were here last week.
So, because my kids are not his kids, there's a little bit of tension because I may not always be firm with setting rules with them.
Okay.
And they may or may not take advantage of that from time to time, which then causes tension between me and my husband.
Okay. So how old are your kids?
10 and 12.
10 and 12. Okay. So they are kind of testing the boundaries a little bit, it sounds like.
Yes.
In a way that your husband doesn't appreciate.
Mm-hmm.
And it's creating some, would you call it conflict or just some tension?
Just some tension as of right now.
Okay.
But I could see even further down the road that it could possibly become more.
Okay.
Especially when they become teenagers.
Okay.
Probably.
Okay.
Could be bad.
So it sounds like you see a little bit of a problem here, but your husband sees it as a bigger problem.
Yes.
Is that fair to say?
Yes.
Okay. So what kind of boundaries are we talking about here?
Well, every night, my son, who's 10, will ask to sleep with me.
Okay.
Which then puts my husband out.
Okay.
So he can't obviously sleep because it's just too much, too crowded. And my son will cry.
Okay.
And then I will feel bad because I know the relationship that he has with his father.
Okay.
And how strict he is with him, and then I feel like I want to balance that out, so then I just kind of let him get away with it.
Okay. So he has these very firm other boundaries when he's with his father, and then when it comes to you, that's all playing around in your head, and you kind of can't keep the firm boundary.
Right.
Can you tell me what you think should happen in this situation?
Well, what should happen in this situation is staying firm with telling him that he has to sleep in his own bed and that he needs to respect me, and when he's crying, it's like he's trying to manipulate me.
Okay.
Just so he understands what behavior he's doing. But it's difficult when he does start crying about it.
Okay. So it sounds like in your head, kind of, you know that the boundary is important, but then your heart plays into it, and he's your little boy, and he's
my baby,
sweet, and he's crying, and you want to make him feel better.
Right.
Okay. What
Me too. I am too.
What would you like to have happen?
What I would like to have happen is for him to start being comfortable sleeping alone and being okay with just some of the difficulties that it is, even as a kid, sleeping at night alone, and your imagination wanders. But being okay with sleeping alone and respecting me of not then coming down in the middle of the night and me having to go and put him back to bed and just
Mhm.
going through this whole cycle and just him respecting me and
Yeah.
Honestly my daughter as well, because she does the same thing.
Okay. So
And
the
she-
situation
yeah.
kind of snowballs.
It snowballs.
Okay.
So then I'll end up with 2 kids in my bed.
Okay. So we've kind of, you've established that having your kids there is something comforting for them.
Mm-hmm.
Sounds like it's probably a little bit comforting for you as
Yeah.
well to have them near you.
Yeah.
And then on the reverse of that, it's really hard on your husband,
Mm-hmm.
which then in turn is hard on your relationship with your husband.
Right.
So we've got some reasons why it's hard to change this behavior, but
Yeah.
some reasons why it also might be beneficial to change it.
Right.
What would be the negatives of changing the situation?
Just the closeness,
Okay.
that bond.
Mm-hmm.
I feel like when they're at their dad's, they don't have that at all. They never even not once asked to sleep with their dad,
Okay.
which is oddly satisfying in
Mhm.
itself,
Okay.
because they still always choose me and
Mhm.
want to and feel comforted with that.
Mm-hmm.
And they honestly do sleep better,
Okay. Okay.
which is nice because I know that they're sleeping and I know that they're good. And I know that Evie, she's actually sleeping and she's fine. Whereas if she's not sleeping with me, she'll be on her phone, which is another boundary
Okay.
that she breaks.
Mm-hmm.
And she'll get on her phone, or she'll draw, or she'll stay up till 4:00 in the morning.
Okay. So there's the supervision factor.
Yes.
Is also playing
That's
into this.
yes. Mhm.
Okay. So, what do you see happening if nothing changes?
If nothing changes, I feel like my oldest one will probably eventually just not want to anyways, because she's becoming a
She'll
teenager.
grow out of it, maybe.
And Emery I could see eventually growing out of it, but probably not for a while.
Mm-hmm.
But if it continues, that continues then with the tension growing between
Mm-hmm.
me and my husband of not getting that time alone either. So then he continues maybe to start resenting me
Yeah.
for that.
Okay. Do you feel like you're able to make changes?
Yes.
Okay.
But being consistent is hard.
Okay. So maybe initially
Mm-hmm.
you're able to sort of set the firm boundary, but then the next night it's okay.
It's a hit or miss.
Okay. And I don't have to tell you anything about the importance of consistency, so we won't touch on that. But okay, I can hear that you are concerned about what would happen if you didn't change anything. That yes, your kids eventually they're not going to want to sleep with mom.
Yeah.
Or you would assume.
Yeah. I mean, I don't know. I wouldn't think that they'd still be sleeping with me now.
Didn't exactly plan on this.
Yeah.
But but you're also concerned about things in your marriage.
Yeah.
And, you've already exhibited that you're able to set boundaries. It sounds like you have done that.
Yeah.
It's just kind of like the follow through and the consistency.
Yeah.
What do you think is sort of standing in the way of the consistency?
Being tired, first off.